For this lab video, we're going to be looking at the structures on the humerus bone and the ulna and the radius. So this is going to be the bone that's in your upper limb. So connecting to your scapula on down to your elbow, so from shoulder to elbow. And as we look at it, we're going to talk about the proximal end, which is up here, around here. That's going to be connecting to your shoulder. And then down here is the distal end. That's going to be connecting with your elbow. So first looking at the proximal end, so where it's going to hook into the scapula, this rounded area, that's the head. So we have the head of the humerus, so this whole rounded area. And then on the other side, we're going to have these bumps, and these bumps are called tubercles. So there's one that's directly opposite to the head, is much wider. That is called the greater tubercle. And then there's one that's kind of in between the greater tubercle and the head. This one is much more narrow, is the lesser tubercle. Okay, so we have greater tubercle, lesser tubercle, and then in between, we're gonna have this groove here. So the word we have for between is inter. So this is called the intertubercular groove, or you could say the intertubercular sulcus. Okay, your bicep muscle, there's a tendon that travels right through that groove to attach over here. So we have those two tubercles in the intertubercular groove or sulcus. And then if you go down kind of a third of the way down, you'll find this kind of bumpy area, and that's referred to as the deltoid tuberosity. So we have tubercles and tuberosity. Okay, that gives us kind of a rough area for your deltoid muscle to be able to grip onto the humerus bone at. So right down on the third, that's the only thing you'll have to know in the middle of the bone. So if it's pointing to a part in the middle of the bone, you know that's the deltoid tuberosity. So those are structures on the proximal end, so towards the shoulder. Now looking at the distal end, okay, so where it meets up forming your elbow. So as you see these smooth, flat surfaces here, okay, technically these are some condyles. Remember we talked about occipital condyle, mandibular condyle. So that's what these are, forming part of a joint, but they're gonna have special names. So this one over here that's more rounded is called the capitulum. Kind of like capitulum. This comes from the word capital, like the head, kind of looks like a smaller head. So capitulum. And then this one kind of looks like a bow tie or one of those tops you might spin. This whole structure here is called the trochlea. Okay, it refers to like a pulley system. So we have the capitulum and the trochlea. So those are some special names for these condyles. So then we're going to have these ridges of bone that are situated above or upon these condyles. So we have the term epicondyle. So epi meaning above or upon. So the one closest to the trochlea, that is the medial epicondyle. The one closest to the capitulum, it's not as well defined, that's the lateral epicondyle. Okay, another thing you can look for is to know medial and lateral. Okay, think about which way will the head be pointing. Okay, that has to be pointing into your body. So the side that the head is facing, that's the medial side. So if you find the head and then travel all the way down, you know you're gonna look at the medial side there. Okay, and also the medial epicondyle is much larger in size compared to the lateral epicondyle through there. Okay, so we have these condyles, epicondyles, and then we also have these grooves or depressions called fossas, right? So on the front, and again, one of the ways you can know you're looking at the front is if you see the capitulum, or if you can see the lesser tubercle, that's on the anterior side. So on the anterior side, the much smaller fossa is called the coronoid fossa. Again, we're back to we have coronoid through there. And then on the back, so if we flip it over, a much larger hole is the Olecranon fossa. Okay, so you can't see the capitulum anymore. You can't see it over there. On this side, we don't see the lesser tubercle. That's still part of that greater tubercle there. So this is the Olecranon fossa. I kind of think it looks like an O for Olecranon. Okay, so we'll see how that fits to form the elbow. First, just looking at the ulna and the radius. Okay, so first one, this one that kind of looks like a wrench, okay? This is the ulna. I kind of think there's a U up here, U for ulna. And then this other one that has this flat top here, okay, is going to be the radius. Okay, what's kind of confusing though is that the bottom of the ulna, the distal end, come down here, kind of looks like the top of the radius. Okay, but here's the head of the radius. So they look similar, but be sure to keep those two different bones in mind. And if we look at the other end of the radius, it doesn't really look like the ulna. Okay, so look for that crescent shape of the ulna. Okay, that's where like this moon shape. All right, so these are gonna sit into the humerus. So these names are gonna be very similar to the names we talked about on the humerus for those fossas. Okay, so we'll do this first. So on the ulna, this groove here, right in here, is called the trochlear notch, okay, because it's gonna sit and swivel on the trochlea. And then we have these two processes forming on the bottom and the top. So the one on the bottom, the smaller one, is the coronoid process. And the one on top, all through here, is the olecranon process. Okay, your elbow, when you feel that bump on the back of your elbow, that is the olecranon process. All right, so can you imagine how these would sit together? All right, so that trochlear notch right in here, that's gonna be sitting on the trochlea of the humerus bone. Okay, trying to get as many hands here. And then this coronoid process, that's gonna be moving as we bend our elbow, and that's gonna go into the coronoid fossa of the humerus bone. So we have the coronoid process on the ulna, coronoid fossa on the humerus. And then if we flip it over, okay, we're gonna have the olecranon process going into the Olecranon Fossa. So as you bend your elbow, that's the motion that's happening. Okay, so we have those structures. Also on the proximal end of the ulna, we're gonna have this thumbprint looking structure here. That's called the Radial Notch, because that's where the head of the radius is gonna be sitting in here. Something kind of like this. Right, so it's gonna form some connection like that. And then actually the radius is gonna be swiveling on that capitulum. Okay, so the head of the radius is gonna sit on the capitulum of the humerus bone. So these are the bones in your elbow. So the larger notch on the ulna is the trochlear notch. And then this one that kind of like where your thumbprint would go, that's the radial notch. So those are all the structures to know on the proximal end. On the distal end, near your wrist, there's gonna be this bumpy part here that's sticking out. That one is called the styloid process. Okay, remember we had that sticky kind of styloid process on the skull, similar kind of thing. If you look on your pinky side, there's a bone sticking out on your wrist, that's gonna be that styloid process. So then looking at the radius, there's just a couple things to know. So the smooth part, the top, is the head of the radius. We said the head is going to be on the capitulum and it's going to be swiveling back and forth, actually. There's a pivoting motion that happens there. Whoops. So as you move your arm, as you rotate it back and forth. So we have the head, and then this narrow part here is called the neck. Okay, so we have the head and the neck. And then as we move down to the distal end, we're going to have another part. See how it kind of points down here? That is going to be another styloid process. Again, if you're looking at your wrist, when you see the styloid process on your thumb side, that's on the radius. So these are going to be kind of sitting something like this. And that's where we have those two bumps that are on either side of your wrist. And I remembered there's one thing I didn't mention on the humerus. So if we go back, when I talked about the neck, I remembered on the humerus, we have two necks to know. So again, we had the head here, and then we had these tubercles. So there's this groove going through on either side around the neck between the greater tubercle. All of that is referred to as the anatomical neck. So I think right beneath the head, that makes sense. Your neck is beneath your head. And then through here, if I had like a piece of tape or a pipe cleaner going around, just like the shaft of the humerus, that is referred to as the surgical neck. So we have anatomical neck and then surgical neck. So for the humerus, be sure to remember those terms in dealing with neck. For the radius, all you'd have to label and identify is the neck through there. Okay, so those are some structures to know on the humerus, the ulna, and the radius.